Okay, the topic of this teaching video is posterior vitreous detachment, a common ocular condition that causes symptoms of flashes and floaters, but no loss of peripheral vision. The cause for this is best explained using this model of the eye. This is a model of the eye, and inside the eye, lining the back, is the retina, a thin film of neural tissue that turns light into a nervous impulse that travels to your eye by this nerve. There is a jelly that fills your eye called the vitreous humor, and that is stuck to the retina when you're born. As you get older, this jelly becomes liquefied, and at a certain point it begins to shrink such that the back surface comes forward. The front surface is anchored. So when it comes forward, it pops off, and that tractional pulling on the retina causes flashes. Sometimes when it pulls free, it pulls tags of tissue off with it. So pieces of the retina are stuck to the back of the jelly, and therefore when your eye moves and the jelly shakes inside, these little pieces of tissues are seen floating around in your eye, causing floaters. When we hear the symptoms of flashes and floaters, we always want to make sure that the patient doesn't have a tear in the retina. So the ophthalmologist will look at your eye through a dilated pupil to look for tears at the peripheral aspect of the retina. And if none are present, then no treatment is indicated. If tears are present, the patient needs laser treatment around the tears, but for a vitreous detachment, there aren't any tears, and the patient is just educated. Typically what we'll do is we'll ask the patient to cover one eye, the eye that's not involved, and while looking out with the other eye to see if there's peripheral visual loss. So the patient's looking straight ahead and using fingers in the corners is able to detect if there's any peripheral field loss, and that's a home test to indicate to the patient the need to come back in for a recheck. Most of the time, well over 95% of the time, this doesn't evolve into a retinal tear. But sometimes it can, so that just because an initial examination clears you for that particular visit, you can't assume that you won't get into trouble down the road. If you have any further questions, I would recommend that you look at the information document under posterior vitreous detachment on this website.